I'm Dr. Cassie from NABC's Vetfolio and the host of Vet2Vet. Today we're talking about managing osteoarthritis in cats, and thanks to more research looking into how to diagnose OA, reduce pain, and improve the quality of life for our feline patients and their owners, now we've got more options than ever. Joining us today is Dr. Kristen Shaw. She's an accomplished and highly skilled double board certified veterinary surgeon. Dr. Shaw is also a full-time pain specialist at Zoetis. Her career has focused on bridging the gap between surgery and rehabilitation with an emphasis on management of osteoarthritis. Hello, Dr. Shaw. I'm so glad you're here to talk to us about cats and osteoarthritis. I mean, they're tricky patients. They like to hide their pain. But when you're able to show owners the difference between a painful cat and a painless cat, it's an amazing difference.
Yeah, you're so right. And thank you so much for having me, Dr. Cassie. It's great to see you as always. And you couldn't be more right. It is finally time that we are recognizing that cats do experience pain, and we need to educate our pet owners and cat owners about what that looks like, because we have something that can really change their lives.
Yes, absolutely. And sometimes I feel like it's like we know they're experiencing pain, but then it's like, what do we do about it? There's so many limitations sometimes. So, the more options, the better.
Absolutely, absolutely. But it definitely does start with finding those cats that are in pain and then doing something about it.
Yes, I think you make a good point because there are those cats where like, I know you're sore and I'm struggling with options of what we're going to do about this, but like we said earlier, they hide their pain. They don't like to tell us.
Exactly. Yeah.
So let's start by talking about something kind of exciting, and that is NGF, or nerve growth factor. This is not something I remember learning about in vet school. So tell us a little bit about what NGF is, how does it function in the body, why is it important?
Yeah, I didn't learn about it in vet school either. I went to the same vet school, so I don't think it was just a matter of
Go
our
Gators!
education. Yeah, go Gators. I talked to people around the country about this, and nobody was taught about NGF in vet school, because it's not that researchers didn't know about it. It just, we didn't know at the time how relevant it was. So what NGF is, so nerve growth factor, it is actually a growth factor. So its initial role is as a growth factor for the nervous system. So it plays a crucial role in growth and development of the nervous system in utero and in postnatal development. But once an animal or even a human is developed, their nervous system is developed, the role of NGF then switches over. And one of its key roles is actually a very, very potent pain signaling molecule. So once it was recognized that NGF plays a very important role in transmitting pain, and especially chronic pain associated with OA, there's been a lot of research into how we can use this as a therapeutic target.
Interesting. So, talking about its role in pain, this leads to the term neurogenic inflammation or neurogenic arthritis, which, as I understand it, is new terminology. Like you said, we weren't really talking about NGF and its role in pain. So, can you tell us more about what do we mean by neurogenic inflammation?
Yeah, so the understanding of neurogenic inflammation, that's not new either. Actually, researchers recognized this back in the early 1900s and late 1800s. And what it means is actually the nervous system itself is the source of inflammatory products. So traditionally, we think of our immune cells, our inflammatory cells, as releasing PGE and TNF alpha and those inflammatory cytokines. What neurogenic inflammation means is when the nerve itself is stimulated by a pain signal, it turns around, that nerve literally turns around and releases substances, including substance P and CGRP, at the level of the joint. And those two products contribute to vasodilation, which leads to swelling and redness. It leads to leaky capillary membrane. So, again, more swelling and redness. So, it's a different form of inflammation than what we were taught, which was all associated with the immune system. And the reason this is important is because NGF plays a very, very important role in generating that neurogenic inflammation. Other things that NGF does is it NGF sensitizes the nervous system. So it makes that nerve more easily send a pain signal. It causes the nervous system to physically change. So over time, pain signals are amplified and pain gets worse and worse. So that's called central sensitization or central plasticity. And then that neurogenic inflammation component. But one other thing I want to highlight that NGF does is it actually, as a growth factor, leads to ingrowth of more nerve endings at the joint. So now we have more opportunities to send a pain signal and more opportunities for that neurogenic inflammation to occur.
Okay, I have so many questions, and I know we probably don't have time. Like, all right, let's break this down. If I can, just throw in a couple here out of my own curiosity. Like, I really want to go down the substance P pathway and all of this, but I'll hold myself back. So is it the nerve is stimulated by NGF, and that's where we're getting this pain signaling?
Absolutely. So
Okay.
there are a lot of different molecules and cytokines that bind to their respective receptors on a nerve ending. For example, PGE binds to one of its receptors on the end of a nerve. NGF binds to its receptor called TrkA on the end of the nerve. And that sensitizes the nerve. And then it opens up various different ion channels, and we have influx of sodium and things like that. But essentially, all of these different molecules bind to the nerve ending and make that nerve more easily send a pain signal.
Interesting. Is there a protective mechanism for this NGF? Like, is there a physiologic function aside from just pain signaling and creating more nerve endings and more pain?
Yeah, well, I mean, again, back to its initial role in growth and development of the nervous system, and then it does have some constitutive roles that it plays, especially in the central nervous system in the brain. And we'll get to NGF as a target, but I'll say right here, when we use our anti-NGF monoclonal antibodies, those aren't going to cross the blood-brain barrier. They're not going to cross a lot of the tissues to get to where NGF still does play some constitutive role. So, like most things, we don't want to eliminate NGF altogether. What we know happens is NGF levels rise in OA and chronic pain, and we're just trying to get them back down to a normal level, not trying to eliminate NGF altogether.
I see. I see. Thank you for letting me go off on a tangent there. As soon as you gave the answer, I was like, wait, I want to know all the things now.
No, thank you for clarifying that because that's a very, very important point.
Yeah, absolutely. So, like you said, we're going to get to this targeting of NGF, kind of enter Solensia here, which is designed to target NGF. Tell us more about Solensia. How does it interact with NGF?
Yeah, so Solensia is a anti-NGF monoclonal antibody, and it has been designed, it is considered felinized, so it's speciated. So what that means is this big protein, this monoclonal antibody, has been designed to look just like a naturally occurring cat antibody. And when you give Solensia, it binds to that NGF, it neutralizes it and prevents that NGF from binding to its receptor on the end of the nerve or on inflammatory cells, and basically breaks that whole NGF cycle. So we're again trying to reduce the action of that elevated levels of NGF using a monoclonal antibody.
So it makes me think of like the term wind up when you're
Mhm.
talking about like central sensitization. Are we talking about the same thing there?
Yes, absolutely. So central
Okay.
sensitization, central plasticity, wind up, that's where over time the nervous system physically changes. So it becomes easier to feel pain. We get abnormal pain signals, so spontaneous nerve firing, allodynia, where a non painful stimulus now feels like pain. So, absolutely, NGF plays a really, really important role in that physical change, that wind up. And by using Solensia, we can block and reduce the development of that wind up and central sensitization.
This sounds so cool. Like just so many options. I love the fact that we're talking about a monoclonal antibody. I mean, that technology is really interesting and it sounds like there's so many opportunities and the opportunity to be able to manage arthritis in our feline patients using this targeted monoclonal antibody is just so cool. Like I said, I want to go down so many pathways. And in the interest of time, I'll try to kind of stick to what we're here to talk about. But when it comes to Solensia, I guess my first question is, how do I use it? Where and when do I incorporate into a feline arthritis management plan?
Yeah, well, we care about arthritis in cats or dogs or humans because it causes pain. So as soon as we recognize that that cat is in pain, which, we could go down that rabbit hole of how we recognize, but I think for now we're not. once we make that diagnosis of cat pain, that's right then and there. That's when you start Solensia. It's the only FDA approved product for managing OA pain in cats. And so right then and there, it really should be our first option. The most recent AHA pain guidelines came out and said that anti-NGF monoclonal antibodies really are considered first tier treatment for OA pain in cats. And so that's where we would reach for Solensia.
I love that it's just,
Mhm.
you don't have to wait, you don't have to play around. It's just
Mm.
as soon as you see and identify arthritis pain, go ahead and start that cat on Solensia.
Absolutely. Because if we wait too long, I think that is a tendency, and especially many people with cats and with off-label use of NSAIDs, we've had some hesitation to sometimes use our big guns. But if we wait too long, that's where that central sensitization and windup really starts to occur, and it becomes so much harder to get ahead of it once it's set in.
Absolutely, that makes sense, and I know I've definitely been guilty of that. And I'm glad that we're having this conversation where you're telling us as soon as you see that pain, start the Solensia, because I could see myself still doing that of going, well, what do we need to do? What's the safest thing? I think that's just a good rule of thumb. Of the pain guidelines state that this is a first tier use of this medication, and just go ahead and get these cats more comfortable.
Absolutely, absolutely.
So how are we giving it? Is it a pill that an owner has to give at home? Is it a liquid? Is it an injection?
Well, that's one of the really cool things about it as well is it's a sub-Q injection. So it's a once a month subcutaneous injection that's given by the veterinary team. So it's given in the veterinary hospital. And it takes about 2 injections to reach steady state. But what we're finding is that many cats, you'll actually start to see improvement within the first few weeks after giving it.
So, full disclosure, I actually knew it was an injection before I asked you that question because I have a patient that got an early use exemption. She's a 20, gosh, she's about to be 21 years old,
Wow.
feline patient with osteoarthritis with pretty significant signs, but also I think she's a stage 3 iris kidney disease. So, NSAIDs have been a little scary for her. And we've been struggling with what to do. So we started her on Solensia, and exactly what you just said. Within the first probably 10 to 14 days, the owner was noticing a difference. So we were really excited to give that second injection. And I got some video footage of her after we gave that second injection. And they said she's coming out and she's walking around the living room now, where she hadn't done that in probably years. She kind of just stuck to her bedroom and her area where she was comfortable. And she's playing. She's chasing a laser pointer around in this video. 21 years old. I saw results exactly like you described.
That is so exciting to hear. It still kind of brings tears to my eyes when I hear stories and see the videos of that. And so, Cassie, hearing about your case, it makes me think of a case example that I would like to share too. This is Dante. He, at the time of this video, was an 8-year-old, so pretty young actually, male neutered cat, and he's actually a cat that lives in the UK, and he was part of an early experience program over there when they started to get Solensia. And you can see him showing pretty obvious difficulty or slowness walking up the stairs. And then he received Solensia, and then you can see a pretty dramatic improvement of him being able to climb up the stairs. And one of the points I want to make on the heels of your success story and Dante's success story is that we expect Solensia to be really quite effective for the majority of cats out there, but no product is going to be 100% effective for 100% of patients. And along those lines, it doesn't mean that multimodal therapy is out the window. We still need to look at the home environment, making sure the cats aren't overweight, and considering some of the other options, especially if we don't see these dramatic improvements that most cats we expect to see.
I agree. When I first saw the video, I remember I showed it to my husband, and he said, "Oh, that's interesting. How old is she again? Is she like 15?" And I said, "She is 20 years old,"
Wow.
and
Wow.
just unbelievable.
That's awesome. I'm so happy to hear that.
Yes. So obviously, she, if there were contraindications, she would probably be a pretty good example of where they would be, and she's doing great on it. But are there any other contraindications, safety information we should be aware of in our patients?
Yeah, absolutely. I mean, anytime we reach for any product, we need to be aware of all of the potential safety concerns. And so the only true contraindications for Solensia are cats that are breeding, pregnant, or lactating. And that comes back to that role of NGF in growth and development of the nervous system. So in terms of your individual cat patient, the only contraindications, again, breeding, pregnant, and lactating. One thing that we do have to be aware of, back to that role of NGF, is if a human woman were trying to conceive or pregnant or breastfeeding, there would need to be extreme caution that that woman didn't self-inject with Solensia. So for that reason, we strongly recommend not sending the product home with your clients, as tempting as that might be, but the potential issues there are real. Beyond that, as a monoclonal antibody, the safety profile is really exciting. That's certainly one of the benefits of it. But what you'll see when you read the important safety information is the top two side effects that were noted in the clinical trials were injection site pain and vomiting. The other thing that has come out is there's a few cats, if they have an underlying skin disorder or dermatologic issue, some of those cats may experience kind of a exacerbation of that once they get Solensia. Most typically, that will respond to your normal treatment of whatever skin disorder that was. We recommend kind of getting that under control or any comorbidity stabilized before starting Solensia, but you don't need to stop Solensia in those cases. And the last point I'll make is kind of with your cat with stage 3 iris kidney disease, using Solensia in the face of kidney disease is not contraindicated. In fact, half of the cats in the clinical trials had stage 1 or 2 iris kidney disease, and there wasn't a contribution of Solensia to that progression. There weren't cats in stage 3 or 4 included in the studies, but it doesn't mean that you can't use it in those cases.
Sure, sure. And yeah, and the owner is super happy with how she's doing on this. And of course, that's an N of one.
Yeah,
It's not a huge sample size, but I will say at least in this one case, she's doing great on it.
that's awesome. That's awesome.
Well, this is so exciting. I think this is just going to be an unbelievable asset in practice, drastically expanding our options for feline arthritis management. Where do we find it? When will it be available?
Well, it is actually available now. So it is available to purchase. You just need to talk to your Zoetis rep, and it's available to order as of now.
Well, Dr. Shaw, as always, this has been amazing. Thank you so much for joining me. Any final thoughts you want to share?
Yeah, I guess the last thing I would say is, we've alluded to the trouble and the challenge of diagnosing OA in cats. The statistics show that 90% of cats over the age of 12 have radiographic OA, and 40% of cats have OA pain. So it's those 40% of cats in our cat patients that we need to be looking for. At best, statistics show we're finding about 17% of them. So we really need to get on the ball and I'm saying this as a profession because I've certainly been guilty myself, but looking for those cats, talking to our cat owners and educating them so we can help those cats feel better.
I'm glad that you brought that up because that did come to mind in the beginning of our conversation here where I said, well, sometimes we know, but we don't feel like we have good options of how to treat them. But you're right, there's this huge percentage of cats that we may not be picking up on their arthritis pain. So knowing that statistic, I think, is really valuable and will just kind of make us a little bit more aware, again, like you said, as a profession, because there's no way I've diagnosed 40% of my feline patients with arthritis pain, even though it's there. Looking for it, and we can look for it knowing that we have options to help them.
Yep. And the best way to look for it is actually looking for changes in the cat's mobility and behavior at home. And so there's a checklist that's been developed. It's catoachecklist.com. And this checklist has been scientifically studied and shown to be very, very accurate as a screening tool for finding those cats. And it looks at difficulty jumping up, jumping down, going upstairs, going downstairs, playing, so like with the laser pointer, and running. And so when you use that checklist and you send owners to that website or you use that checklist with them, that can be very, very, very helpful in finding those cats that are in OA pain.
Yes, and I've taken a look at this checklist, and I like that it really gets the owner involved and kind of a team effort to identify this arthritis pain. Well, fantastic. Well, Dr. Shaw, thank you again for joining me. You're always a wealth of information and so much fun to talk to.
Thank you so much, Dr. Cassie. Anytime. I love chatting with you too.
And thank you to Zoetis for sponsoring this edition of Vet2Vet. Check out the Spark section of NAVC's vetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day.